And welcome, everyone. Welcome to the Hair Wire, the place where you, my friends, get hair smart. I'm your host, Sergio Cardona, alongside with Carrie, Jerry, Bisan, Dipsy, and our good friend, Dr. Ross Kopelman. How you guys are doing today?
Good, good. We're excited about this episode today, and we can't wait to hear everything from Dr. Ross.
I'm excited to be here. This is going to be a great conversation.
Yes, it will. Yes, it will, guys. So today we're going to be talking about hair transplant and all the things that we want to learn about hair transplant. And we know we have a great community in the Intelligent Fluid Support Group. And I know they are very, very, very much in anticipation out of this tremendous interview that we're going to have with Dr. Ross here today. Now, before we start, I want to introduce Dr. Ross. Dr. Ross is a board-certified hair restoration surgeon and co-founder of the Kopelman Hair Restoration with offices in New York City, Palm Beach, Florida, specializing in advanced follicular unit extraction and follicular unit transplantation techniques. He also excels in eyebrows, beard, and non-surgical treatments like PRP therapy for natural, long-lasting results. A graduate from Cornell University, NYU, Tufts University, Dr. Kopelman honed his skills during residency in New York, blending surgical precision with artistic eye for hairlines that enhances confidence without looking done. As co-host of the acclaimed Hair Doctors podcast, he champions patients' education, debunks industry myth, and advocates for personalized care, helping thousands reclaim their look and self-assurance. Doctor, thank you for being here with us. It is a pleasure.
What an intro. Okay. Well, I'll tell you one thing that's very important to me: education. And I spend 90% of my time educating patients because I think there's a lot of misinformation out there. So I'm excited to be able to chat with all of you today.
Definitely, Doctor. Definitely. It's a great pleasure to have you here with us at the Hair Wire. There's a couple of things that we definitely want to ask you. And considering your expertise as a hair transplant surgeon, and of course, you are very into what in the hair industry is happening. And I know you're very aware of all the things that are going around in social media and stuff. I think that one of the main questions that people want to know is about what are basically the key signs of a strong candidate for hair transplant surgery. You know, who should really be having hair transplant surgery?
Okay, well, that's a wonderful question. And there's a lot of things that go into deciding whether you're a good candidate, a great candidate for a hair transplant. Number one, the most important factor is your donor supply. Making sure you have a great donor supply, which is the hair in the back of our scalp. Now, the hair in the back of our scalp is less sensitive to a hormone known as DHT, dihydrotestosterone. And so that's why we can take hair from the back to the front. So that's step number one. Step number two, and of course, you can interrupt me at any point and ask me any questions you want. But
Sure.
Step number two is making sure that you're age appropriate. I really don't perform hair transplants on anyone under the age of 25 because if you're a young male, for instance, and you want to restore your hairline, well, I'm very concerned about maintaining your donor supply throughout your life. Okay. One of the most important things when you go to a hair surgeon is you want to make sure that they're thinking not 2 years into the future, they're thinking 10, 15, 20 years into the future in terms of making sure that your donor supply is preserved. And so those are the two critical things that I look for. The third thing is we always have to make sure that you don't have an underlying medical condition that's causing your hair loss at that moment. So for instance, if you do have telogen effluvium, which is a temporary hair shedding condition, you're not a candidate to run and do a hair transplant until that particular condition is under control.
And that's something that unfortunately a lot of people don't realize, or because again they're so stressed out and they want fast solutions, and the first thing they're thinking about is maybe I need surgery. I want to have surgery. Period. I want to get this done and over. I want to have my hair back, and they push as customers, as clients, to get this surgery done. And unfortunately, they might go to your place and you would say, stop it right here. I'm not going to have you done surgery. And they just walk out of the clinic and go to the next place and say, I'm going to find someone who will say yes to the surgery. What do you say about that?
It's very interesting you just brought up that point because I just had a conversation with Spencer Coburn. I don't know if you're
Yeah,
familiar
Yeah.
with him, but he's
Yes.
I saw that. Yeah.
one of the GOAT patient advocates. He's been talking about hair
Hmm.
transplants and hair loss for the past 30 years. But we
Hmm.
talked about that, and there is a big issue. You know, there are ethical physicians like myself who will turn patients away, and there will always be clinics that will accept patients regardless of whether they are good candidates, and that's where it's critically important. The more we educate, the more we get out there, the more that we explain through social media, through podcasting, the do's and don'ts and how to navigate this landscape, um, the better it is actually for patients, actually long term.
That's correct. Well,
May I
thank you
ask?
for saying that. Just I want to say something about that, Carrie, before you say, do you have like any kind of, you do the consultation, of course, during your consultation, do you educate them about what kind of hair loss they have, what type of hair loss? Do you use any kind of trichoscopy to see the scalp condition? How do you look at their lab work or anything of that nature before you decide to go forward or not?
That's a great question. And the answer to that question is most clinics will try to sell you a hair transplant the minute you walk through the door.
100%.
My philosophy is quite different, actually. My philosophy is I spend the first half of the consultation just talking about what the root causes of hair loss are, talking about the importance of medication or natural ingredients to help stimulate hair growth is. Because I explain that the long-term success of a hair transplant is medical management, which could be pharmaceutical or natural, paired with a hair transplant. And I think too often we have seen patients who previously 15 or 20 years ago they ran to do a they ran to go do a hair transplant. Okay, and the physicians were not proactive at
Mm-hmm.
medical management. They didn't want to do it. Why did they want to do it? Well, they're not making money. Okay, there's not an
Right.
incentive, a very high incentive. They rather sell a big ticket item and then move on to the next patient. But my philosophy is different, and I think it's very similar to a trichologist's philosophy, which is you're taking care of this patient long term. It's not a
Mm-hmm.
one-off, one done interaction. These are
Mm-hmm.
lifelong relationships that I'm building, and I'm sure that you're building with your own patients. And so, really spending the first and this is a message to anyone listening who's thinking about going for a hair transplant. If you're going to a clinician, someone who's going to do your transplant, make sure that the first thing that they talk about is not the transplant;
Mm-hmm.
it's medical therapy.
That's true. Yep.
So that's my approach.
Yep.
Can I have? I'm always curious. What is the common age for women or men that you would recommend to do transplants? Because I don't know if it's like how you explain this, but I've heard that certain age groups shouldn't get transplants until they meet a certain age because men go through puberty through a certain time, women go through puberty through a certain time, and then come perimenopausal. Are there age restrictions or something that you are see flags on or common?
Yeah, so one of the things I alluded to for men, typically we don't want to do hair transplants really until you're in your 30s. Okay, when your donor supply is a little more stable, we know where your hair loss is at, we start you on meds. For women, there's a lot more flexibility. So let's say women, they might want to lower their hairline. There might be a wide part they want to get rid of. There's more flexibility to do hair transplants at younger ages. Um, and their hair loss is not progressive like it is for men. Men gradually have temporal recessions, as you know, and so it's good to wait until the ideal age is mid 30s. That's when you should really start to think about doing a hair transplant. If you're in your 20s, I'm very cautious about doing a hair transplant for a young guy in their 20s, unless they have a really good donor supply.
Thank you.
That's something very powerful right there. When we talk about the donor area, one of the things that most people don't realize is that if they get a bad surgery, that donor area is basically ruined.
Yeah.
What do we say? What can we say to people? And the importance of choosing the right surgeon whenever they are going through this process.
There are too many, especially younger guys, and I keep targeting the men, but
Yeah.
who are price shopping for the quote unquote the cheapest hair transplant. Okay,
Yeah.
and there are clinics in the United States that are cheap. There are clinics in Turkey that are cheap. And the reality is that you have to recognize that you should go and you should seek out someone who's the most qualified in the space to do your hair transplant because you're less likely to get complications. Everyone gets complications. I know all the top hair surgeons. Every single person gets complications, but you're
Yeah.
less likely to get complications because my colleagues, myself and my colleagues, we take patient care seriously and we do everything we can to avoid complications. And at the end of the day, if you do have a complication, you want to go to someone who's adept and knows how to manage those complications. I have treated patients who have had poor hair transplants because they were price shopping. Okay. I had a patient who flew from California who had a poor job done of his hairline. I had a patient who went to Turkey, had too much hair extracted on the side of his scalp. The
Yeah.
biggest thing that I spend time really saying slow down and be cautious is who you go for your hair transplant. You may have to pay more, but paying more is almost a guarantee. And I don't want to say a guarantee, but it lowers your risk of getting a poor hair transplant.
What is the biggest number of grafts you extracted?
So there are different size hair transplants. The average hair transplant in the United States is about, I would say about 2,500 grafts, which is about
Yeah.
5,000 hair follicles moved from the back to the front. But I do believe that if you are in your 50s and 60s and you have a stable donor supply, you can take a lot more hair than you think. You can take
Okay.
5,000, 6,000 grafts without causing issues to the donor supply.
With the
And
FUE method.
with FUE. With FUT, you can't do that. So there's two different approaches to hair transplants. There's FUT and FUE. FUT historically was the most popular way that we perform hair transplants, but today, about 85 to 90% of hair transplants around the world are performed with FUE, where we take individual hair follicles out from the back of the scalp. One of the downsides to FUT is we're kind of we're flying blind, right? We're taking this strip from the back of the scalp. We don't know how many grafts we're taking out. We're kind of, it's a guessing game until our hair technicians actually divide and cut the follicles. Now, the benefit of an FUT is that you actually get really good grafts. Grafts look healthy. They're handled better. With FUE, there's a higher rate of getting transections. You can lose some follicles as you're extracting hair. But the benefits of an FUE is you can take care from a wider range of territory. You can also, if you're a male, take hair from the beard and transplant hair underneath the chin to the top of the scalp. So FUE does provide us with more flexibility. I do perform both approaches to hair transplants, but I do lean more heavily on FUE, and I think it's going to continue to be more and more popular as we move forward. But I do think FUT still has a role to play in hair restoration.
Okay. So you still do sometimes FUT?
Absolutely.
Okay.
I think FUT is a great approach for women. If you want to take a wide enough hair to make an impact in the front, but there are more advanced techniques now that we do at our practice called non-shave FUE. A non-shave FUE is ideal for a female patient. What female patient wants to shave the back of their scalps? Zero. So we have at our clinic, we do a very advanced approach to extracting hair. Essentially, you don't shave anything. You just raise a certain area and boom, 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 boom. We punch it out, but you don't have to shave anything. And then you don't have to wait 2 or 3 years for your hair to grow back.
Yeah. So do you just cut them a little bit so you can extract them?
You don't even have to do that.
Oh, wow. With the long, it's called the long hair.
Long hair FUE. Hair FUE, or you can do direct extraction where it just cuts the hair follicle as it's being taken out.
Sorry, I want to just 1 second here. I want to take you back a little bit. Talk to us about the qualification of a hair transplant surgeon so our audience will know what to look for if they want to go or decide to go to find a hair transplant surgeon.
Absolutely. So you want to seek out a hair transplant surgeon who, number one, has completed training. Okay, they have to be a doctor, number one. That is critically important, and that's who you want performing your hair transplant, doing the extractions, doing the implantation. Those are critical things. You want to look for a physician that's involved in the the societies, the hair restoration societies, who are actively going to conferences and engaging with their colleagues. That's critically important. You can become a hair surgeon from really any specialty. If you have a surgical background, that's a plus. And of course, if you do fellowships in hair restoration and hair transplants, that's important. I've traveled around the globe, and I've trained with colleagues of mine who are some of the top in the world, from Guatemala to Brazil to Israel. And so I'm very lucky because I'm constantly learning the most advanced techniques. And that's essentially what you want. You want to go to a physician who is pushing the limits in terms of their capabilities, their skill sets. You want them to always be advancing, because at the end of the day, it's all about getting better results.
100%. 100%.
You want to say something, Carrie?
No, this is also fascinating.
Yes.
So I wanted to jump in, piggyback on what you just said, Dr. Russ, because we know there are many clinics that their physicians are not the ones who are performing the hair transplant surgery, that they have a group of technicians that do the surgery for them. And although many of these technicians are highly skilled persons, what is your opinion on this subject?
So the first thing that you have to understand is that a hair transplant is a team-based sport, okay? There are many individuals, many medical professionals that need to be involved to do a hair transplant. When we do hair transplants at our practice, about 5 to 6 people involved in your hair transplant from 7 in the morning till 4 or 5 o'clock in the afternoon. It's a tremendously long day. So the parts of the surgery that I'm responsible for are, of course, hair design. That's critical. That is the art of the hair transplant. So spending a solid 45 minutes in the morning designing the hairline, making the incisional sites, everything, that's what I do. Extracting hair is also what I do. And what is the role of the hair technicians? Well, they are there to kind of harvest the hair that's being plucked out from the back of the scalp with the surgical instrument that I use, and then dissect it underneath a microscope, and they're there to also plant. So hair technicians are not supposed to be doing surgery, and that's essentially what my philosophy is. It really should be the surgeon who's doing all of the extractions, because this is a surgical procedure, and ultimately it's the doctor that should be doing the surgery.
100%.
Amen to that.
And I want to applaud you about that, and I want to actually highlight something that we were talking off stage before we came on live, that you are interested in the trichology world. Please,
absolutely,
talk to us about that.
I think, look, the trichologists have a big role to play, because, for instance, we know that dermatologists who see a lot of skin are also starting to get a lot of inbound interest from patients to help them with their hair loss. But dermatologists are not that good at doing trichoscopy, identifying root causes for hair loss. And so having a trichologist on board, on your team, in a medical practice is always a great idea. That would only enhance a patient's ability to address their hair loss. So I think trichologists have definitely a role to play in terms of helping guide the medical team in terms of treatment options. And of course, trichologists, as you can all speak about in more detail, you are also able to treat patients with natural ways of stimulating hair growth. And I think natural actually has a big role to play in hair loss as well, because we're too quick to run just to pharmaceutical medications. Now, I'm not going to lie to you and tell you that I think natural is above pharmaceutical. I do think pharmaceutical medications are best tools, but I have seen patients benefit from using rosemary oil and saw palmetto and pumpkin seed. These are natural DHT blockers, PRP, red light therapy. So there are, of course, doing a blood test and changing your nutrients in your diet. All of this contributes. And so I do think, trichologists have a big role to play in terms of helping patients navigate hair loss.
Thank you. I want to apologize for our friend Sergio. He has actually a course to teach in 6 minutes, and he is teaching a course with the Italian Academy of Hair Microscopy, an online course to teach to spread awareness about trichoscopy use in trichology, and he didn't want to interrupt you. That's why I'm going to apologize on his behalf, and we're going to
No
continue.
reason to apologize. We all have very busy lives, so
Right.
it's absolutely understandable.
It happened that he had this live today at 12, like 5 minutes from now. That's going back to your point where we all need to be furthering our education all the time. Either you are a trichologist or a hair transplant surgeon or anything that you need to keep updated with all these technologies. So if Carrie don't want, if you want to give me a question, I want to ask you about them, like what kind of medical interventions you will do for women who have telogen effluvium if they come to you asking for hair surgery.
Okay, so absolutely, we're not going to do any hair transplant on anyone who has telogen effluvium, because this is a temporary hair shedding that typically lasts 6 to 9 months and then resolves. So during that period of time, hair transplant is never a discussion. The first thing that we have to discuss is how do you treat the telogen effluvium? And of course, you can do anything in your life to de-stress. That's critically important. Sometimes we order blood work and just to see, do they have a decrease in B12, vitamin D, their iron levels. We check ferritin, which is iron storage. All of these things are important because then we can figure out, do you need a multivitamin? Do you need something like Nutrafol or Viviscal or one of these multivitamins that can help with hair loss? My philosophy is I never put patients on multivitamins or Nutrafol or any of these things unless I do a blood test. I think it's overkill. I think too many patients have gone on medications like Nutrafol and they think, oh, okay, that's
the result. Yeah.
But I see more diarrhea than hair growth. So
and liver failure. They actually have a couple of lawsuits for liver failure.
Yeah, Nutrafol will never endorse me. And I know that for a fact. So, but that's okay because at the end of the day, we have a responsibility to tell the truth and educate our patients and put our opinion down. Okay, because maybe my opinion will change in the future, but this is what my stance is at the moment. But some of the other treatments that I do find important are I do find putting women on DHT blockers like dutasteride or finasteride do help with the telogen effluvium. Typically with the telogen effluvium, I also see androgenetic alopecia. So it's kind of a combo. And then minoxidil. I like minoxidil because it thickens the hair. It slows down the shedding. But of course, there are patients that don't want to be on pharmaceutical medications.
Right.
And so I try rosemary oil and pumpkin seed and saw palmetto. And
it is so nice that you're actually saying that because I don't hear that sentence from any doctor.
Really? They never talk about natural?
Zero.
Interesting.
They always oral minoxidil.
We were taught it in our program, but we were never, nobody talks about it aside from in school.
Yes.
Yeah. Like our professor taught us that, and then it's not talked about behind the doors.
Yeah. No, it should be talked about more because what's interesting is there's probably more patients that don't want to be on medications than who want to, like there's more patients who want to be on natural things than pharmaceutical things.
Because now we have because like I think the wave now is going more into functional medicine and going natural holistic treatments. People are more aware about like the side effects of pharmaceuticals and they're more educated. And as you said, like you have a TikTok channel that you educate people about hair loss. So people are more aware about hair loss and most of them are seeking more natural solutions. But since we have you with us, I want you to talk to our telogen effluvium people, especially this group, because they always ask about oral minoxidil, spironolactone. I love topical minoxidil. I don't have a problem with that. But what about the oral one and the spironolactone and the finasteride and all of that? Can you tell us about what are the best candidates? And we know pharmaceuticals do side effects. So what we can do about that?
So one thing I will say is I appreciate when a trichologist recognizes that it's not just natural that's going to address hair loss. Just like I have to acknowledge also that it's not always going to be pharmaceutical as an option.
It's a balance.
So, I'm in the camp that it's okay to put premenopausal women on dutasteride or finasteride as long as they're aware that they have to stop 3 months before a planned pregnancy. My patients, I believe, are well
Say
educated.
that premenopausal woman.
Premenopausal, like you're planning a pregnancy
Oh,
in the future.
okay.
Most
Wow. Okay.
dermatologists do not put
They
women on
don't.
finasteride
Yes.
or
No.
dutasteride,
Uh-huh.
and a lot of hair surgeons don't. But I do feel very comfortable doing that, and
Okay.
I have premenopausal women on these medications, but they know that they have to stop these medications 3 months before a planned pregnancy. Okay,
I see.
so
Okay.
that I find to be effective, and that's important because DHT is a contributor. I do think it has some role to play in the telogen effluvium and slowing the telogen effluvium down as well. And then minoxidil, I like oral over topical for a reason. You're going to miss a spot with topical. Okay. And if you're going to use topical minoxidil, I like foam versus liquid because it doesn't have propylene glycol in it. Propylene glycol from the liquid minoxidil can be very irritating to the scalp. Women, you can buy, I have the bottle right here. Women can buy men's Rogaine. Okay. There's no, and it's so
5%.
interesting. On this bottle, it actually says, do not use if you're a woman. Okay.
Yeah, that's the 5%.
Which is bullshit. Okay. So there's a pink tax, right? Pink tax is that the bottle's pink and they charge $2 or $3 more. So there's no reason to do that. So you can absolutely use men's Rogaine, and you don't have to use this twice a day, even though the bottle says recommended twice a day, because the half-life of this is 18 hours.
Right.
So once a day is adequate, and that way you can use it longer. They want you to use it twice a day so you get through the bottle faster. But so that's topical, but I like oral because you don't miss a spot on the scalp, and that's essentially what my pharmaceutical approach is. If they don't want to do pharmaceutical and they have telogen effluvium, and by the way, we have to break it down. For instance, like if the patient has a postpartum hair loss, which is a telogen effluvium, right? They just delivered a child. They can't use any pharmaceutical. So we have to use natural things. Red light therapy, possibly PRP, maybe a little microneedling. There's a combination of things that we can be using naturally. Rosemary oil. So that's I really try to customize based upon the patient that comes in, and I always give them the options.
Do you see a lot of low blood pressure, a side effect of the oral minoxidil in women in your clinic?
Not really. Rarely do I see that. And the other thing is, we microdose the drug. So the drug gets cut in half. Women take 1.25 milligrams.
1.5.
I hope you're okay, Carrie. 1.25 milligrams. I always say take it with a half a glass of water. You can be on blood pressure medications and take minoxidil. And there was a study done that looked at patients who are on blood pressure medications with oral minoxidil, and there was no significant change in blood pressure. So I rarely see that. The side effects that I see from minoxidil are the following. I have seen for women don't want unwanted hair growth, right? They don't want to get beach fuzz and stuff like that. But it doesn't happen to most of my patients, okay? So that's number one. Number two, I would say headaches and migraines are the more common side effect, though these side effects are not common. That would be a reason that you couldn't take the medication. And only one time, and this has only happened to one patient of mine, a female patient who put on weight. And she put on like 2 or 3 pounds, but she had so much hair growth that she didn't know what to do. It was a conflict. So, yeah.
So it was a water retention problem, or
probably a little water retention that gave her some weight gain. Yeah.
Okay.
I'm curious, where you're located in New York area?
So I have an office in New York City,
and
in Palm Beach, Florida. So I go back and forth from these 2 different locations.
I'm curious because I'm in Northern Alberta, Edmonton. I'm also between Edmonton and Calgary, where the biometric pressure is quite high, and especially with weather changes, we commonly get migraines, inflammation, headaches. Would you say finasteride and say somebody with an area with higher biometric pressure would be an issue? Because I know a lot of medications we do monitor in this area because of that. I'm just curious, like, what your take on that, because I do see so many clients and they always ask me about finasteride, and I have one that has had heart palpitations.
From
but I'm wondering
from minoxidil.
She took oral. They're trying to balance it out between the oral minoxidil and the finasteride.
I've never seen headaches from finasteride or dutasteride. I've never seen heart palpitations from finasteride or dutasteride. I've seen from minoxidil.
Okay.
That's a more common side effect from minoxidil. And that's, by the way, one of the reasons why I am so against these dual pills that are like a finasteride minoxidil. It's supposed to be there for improving convenience to both male and female patients. But the reality is, you know, some patients are going to be more sensitive to one of the medications versus the other. So, yeah.
And you will not know which one is. Yeah.
So it's best
What
to make
about
sure you're getting two.
Right.
Excuse me?
What about the spironolactone?
So spironolactone is a medication that helps prevent the binding of DHT to receptors. So dutasteride and finasteride decrease DHT in the bloodstream, and spironolactone prevents that binding to the androgen receptors on the scalp. And so I do sometimes add spironolactone. Now, what's interesting is the dermatologists run to put women on spironolactone and minoxidil. Why do they use spironolactone? Well, it's commonly used by many women to address acne. Okay. It doesn't have the same teratogenic issues that dutasteride and finasteride does. And so they just feel safer prescribing it. But is it more effective than putting a female patient on dutasteride or finasteride? No, it's not. And at the end of the day, the reality is women know one thing. What do they know when they're planning a pregnancy? You have to be off of everything. So,
Yes.
we live in a world where people I like to believe my patients are educated. So as long as they're warned, they're told multiple times, they pay attention to these things. So I feel confident putting female patients on dutasteride or finasteride at younger ages than would typically would go on these medications.
Okay. And what about men? Would you put them, what age will be that?
So men are interesting because men are afraid about getting erectile dysfunction. And what's interesting is 1 out of 100 men will get a decrease in sex drive. But that has to be broken down into psychological, which is a portion of that. Another portion of that is you have an erectile dysfunction. And then, there's a couple of men that actually come in with a decrease in sex drive. What was never reported in the original study for finasteride, because the FDA did not classify this as a side effect, is that 1 out of 10 men have increased sex drive. Okay, they actually have increased sex drive. It's never spoken about.
Oh, I never heard it before.
You never heard about it. It was never in the original study. Because what happens is you're converting testosterone to DHT. You block that conversion, guess what? Testosterone goes up. And that would happen with natural things as well.
So palmetto,
pumpkin seed, possibly. Yeah, it would increase it. For 1 out of 10 men, there might be an increase in sex drive. Most men have no change. So what do I do for those men who are worried about the sexual drives? I have a philosophy, and this philosophy was adopted because I started taking finasteride every single day. And what happened to me was not decrease in sex drive, but I got inner groin pain. And I realized that maybe I don't need to take this medication every day. If I don't take it every day, guess what happens? The side effects go away. And we know that dutasteride, especially dutasteride and finasteride, can stay in your bloodstream for days, if not weeks. So I microdose these medications now for basically all my young male patients. All of them. Even my male patient. Excuse me?
What is it? What is the microdose?
When I say microdose, instead of taking the pill every single day,
which is 1 milligram?
For dutasteride, it's 0.5 milligrams. It's a capsule. For finasteride, it's 1 milligram. Instead of taking it every single day, I'll have them take it 3 days a week or 5 days a week, 3 to 5 days a week. And I do that, and I see really nice benefits. And I also have them use a topical dutasteride. Why topical dutasteride? Because it's a much larger molecule than finasteride. And so when you apply it to your scalp, it could stay on your scalp for many days. It's a larger molecule. It doesn't break down as easily. So I parlay that with a topical, and that way my patients' side effects are almost zero. Like compared to other practices, where other practices run and they say, put you on a full day course. But I'll tell you something other interesting. I have heard of many patients who've taken saw palmetto and these other natural DHT blockers, and you can still get side effects from these medications. So natural is not without its side effects.
And doesn't healthy exercise too also increase libido to help balance that out? Would that not have any?
Yeah, of course. Good sleep, like good relationships, like decreasing
depression.
It's a holistic, as you know. I mean, this is what we all talk about all day long. Hair loss is holistic. It's epigenetics. It's a mix of everything. Absolutely.
Epigenetics, yes, 100%. So now, before our time goes fast, I want you to talk to us about biopsies. Our 13,000 members in our group that we will post this link afterwards. Unfortunately, we cannot go live on our group. That's why we will be posting it later. every other day, we have a person who's asking about biopsies.
Every other
Please.
day. If we had a dime.
Yes, please explain that to us in details. Who is a candidate for a biopsy? Why a dermatologist or a hair transplant surgeon would necessarily do a biopsy, and what will come out of a biopsy, and how can we avoid it if necessary?
Okay. Well, one of the things that we've discussed in the past is that dermatologists love biopsies. Okay, they have a predilection. They have a desire to do a biopsy. Why? It has a lot to do with skin cancer. Okay, so when they see hair loss issues, they're going to run to a biopsy. They need to go to a pathologist to confirm. But the reality is, if you're seeing hair loss like I see hair loss every single day, there are classic signs, both from a trichoscopy standpoint and from a medical history standpoint, where you can clearly identify hair loss issues without needing to do a biopsy. And so I rarely, if ever, do a biopsy on any patient that has telogen effluvian, androgenetic alopecia. The only time I really resort to doing a biopsy is if I want to confirm a scarring alopecia, like a CCCA, an LPP, alopecia areata, which is an autoimmune hair loss condition, or FFA, frontal fibrosing alopecia, because I just find that when I have a confirmation that these are scarring alopecias, irreversible hair loss conditions, it gives me more confidence in terms of how I'm going to address the hair loss.
What do you see in the biopsy for scarring alopecia?
What are you going to see? Well, it depends on what the condition is. But you're going to see perifollicular fibrosis. You're going to see areas where hair follicles have kind of the actual area has closed up. And so there's different things that we identify when we do a biopsy to confirm exactly what the particular condition is. But for telogen effluvian, androgenetic alopecia, I don't find it necessary.
Yeah. It's actually, it may cause harm more than actually be effective, right?
The only benefit is to give the patient peace of mind, right?
Right.
It's to give the patient peace of mind. So if you want to do that, if you're really puzzled and you're not sure, yes, you can run off to do that. But most of the time, we can identify telogen effluvian, androgenetic alopecia, and even some of these scarring alopecias without doing a biopsy. If you're really good at doing trichoscopy, as you know, you can identify these hair loss conditions.
That's what I was about to say.
And how frequently do you get proven wrong with a biopsy? I'll ask that back to you. Like you've diagnosed alopecia areata many times. Like how many, has a biopsy ever proven you wrong?
No.
So then why
all the
get a biopsy?
biopsies that I see is, they have inflammation. And actually, I never saw a biopsy. Like I do have this year only, I have 3 alopecia areata clients, only this year. And 3 of them went to a dermatologist and they got a biopsy. And all the biopsy says it's inflammation, but the dermatologist, since it's rounded patches, says it is alopecia areata. So I don't know if actually it is active or not active. They didn't even specify that.
Well, that's one of the other benefits of doing a biopsy. It helps us identify whether the condition is active or not active.
Exactly.
And then that's one of the reasons, for instance, like when I have patients come with classic alopecia areata and they're curious about whether they should do a hair transplant or not. I want to know if it's burnt out or not.
Correct.
Same with FFA.
I agree with you. If you want to do a hair transplant, I agree with you 100%. You want to make sure it is not active so you can do your hair transplant safely.
And
but
I was going to say one other thing. I do find it important to do a biopsy in Black patients, female Black patients, because there's multifactorial reasons why they're experiencing hair loss. And sometimes you don't know, there's also an LPP and a CCCA, and there's some, so there's multiple issues, multiple modalities. And I do think more commonly I do biopsy Black female patients than other patients.
100%. And I did work also on 2 Black ladies who have scarring, CCA. And they went to dermatologists. With all due respect, they did all these cortisone shots for many, many, many years. The hair did not come back. And actually one of them, the hair came back temporarily and then she shed back again because they didn't address the root cause. But I want to go back to my point, actually. We as trichologists, I don't know what is your opinion about that. We look at a trichoscope and we are trained to know the perifollicular scaling. We're trained to see if it is active alopecia areata or not, actually. I'm sure I wouldn't. I mean, we're not doctors. For you, you need a proof to see if it's inactive for you to do a hair transplant safely. But for us, we can actually know if it's if an active alopecia areata or is not active alopecia areata. We can identify LPP. We can identify FFA. So. Like we are trained to do that. My question to you? How much you think hair transplant surgeons has to invest in education in trichoscopy for themselves?
Oh, a lot more. I think more trichoscopy needs to be done. The reality is that hair transplant surgeons want to do surgery.
Right. They don't have time.
They don't want to be
that.
diagnosing, treating these hair loss conditions. In fact, I have colleagues who, if they see these autoimmune conditions, these scarring alopecias, they don't want to treat them. They refer them out.
Okay.
My practice is different. I am very comprehensive. I want to be able to, half of my practice, I want it to be a medical hair loss practice, and half I want it to be surgical. And I think that is a unique mix because it allows us to identify and guide patients, in my opinion, better. If the more enmeshed they are, the better it is in terms of getting results. The other interesting thing is in terms of what I do is because I podcast and I interview other colleagues of mine. Like I've interviewed the top expert in FFA in the world from Spain. Like that increases my ability to give back to my patients, and that's why I love having these types of conversations.
We appreciate that a lot, Dr. Ross, and really because hair transplants, okay, let me say that in a very nice way. Dermatologists, especially dermatologists, don't like us much. They think we're, they don't take us seriously in a way.
We do have a lot of dermatologists, though, that have taken the same trichology program that we have. Right. So there are those that we do love and that love us, but there's some that,
Yes. Yeah. You tell me that because you are very progressive in your thought process. Tell our audience how important it is to have a trichologist in your practice as a hair transplant surgeon, and would you advocate to have a trichologist in dermatology practices as well?
So I'm going to answer this in a very interesting way that you're not going to expect.
Go ahead.
Some of the most followed individuals on social, on TikTok, on Instagram, on YouTube, believe it or not, who are talking about hair are trichologists. Okay.
Yes.
They're not dermatologists. They're trichologists. They're only talking about hair. They're talking about things that dermatologists think, well, they're kind of on the periphery of importance, right? Everyone at the end of the day is going to focus on where they think they're going to make the most money, right? So their focus is not on guiding patients about what shampoo to use or how often to wash their hair. But that's what patients care about, right? Because we all take showers every day and we want to take care of our hair. So it's an interesting kind of mix where they're not aligned, okay? And so I have a lot of respect for trichologists because there are many that have educated a lot of patients about what to do with basic hair care without any medication, okay?
I have the reason why we do that.
Yes.
Because people don't take trichology seriously. They don't know what trichology is. So we as a trichology industry, the leaders of this industry, we put so much work toward educating people like, hey, we exist. We know how to do these things.
Absolutely. Yeah.
You know what I say? There's a place for all of us. So, like, for example, a cosmetologist knows how to nurture the hair that's grown. They take care of it. They make sure it stays healthy so it grows and doesn't break. Then you have the dermatologist who maintains the soil where the hair grows out of. You need to have good soil for good hair production or you're not going to have a good harvest. Then you have the trichologist, and the trichologist is the one that goes and helps with growing hair and planting the seed and make sure that they're essentially the horticulturist. And then you have the surgeon, and the surgeon is like the landscaper. They are the one that go and make sure that everything is producing the way it should, or having to transplant things where they could to where they're going to prosper. So there's a place for all of us, and we need to be working together in harmony because we can't do it all. We don't do it all. And so there's a place for all of us. In trichology, we're trying to bridge that gap, is bring us all together. So
and that's why we created the hair wire, because we had a lot, as Carrie was saying, in the same program we took, there was dermatologists and hair transplant surgeons, and they were on board 100% and with the education part of the clients and the patients, and everything. And that's work.
You
And
are my
that's why
goal.
and that's why we created the hair wire. We created it so we can spread awareness, and also depending on the case, not everybody, not we can't solve every case. Like we need hair transplant surgeon, and like as if it's like our our back, like somebody on our back to like go back. It's like, I do have an FFA case and I can't really help this person. Can you do that? Because as you said, FFA, all these cardiac alopecia, they need medical intervention at some point. So this is when you guys will.
It's about collaboration. I think the whole stack matters from the
100%.
bottom up. Yeah, absolutely. So yeah, incorporating a trichologist into a practice, I think, is a good step forward, especially if you're a dermatology practice and you want to treat hair loss and you don't have a lot of experience. Having a trichologist on board, I think, is absolutely good. Is absolutely a natural step forward.
Yeah,
Yeah,
we need more
dermatologists
round
have
tables
to-
with all of us. Round
Right.
tables.
round tables.
Yeah, I agree.
And dermatologists have only 15 minutes with you. They're gonna solve your hair loss problem in 15 minutes if they are paid.
Look,
by
we give a lot of credit to the trichologists because they've helped us identify hair loss conditions, right? They're the ones that have pushed the field forward in terms of trichoscopy. So
Yes. Yeah, thank you
we
for
have to
saying that.
remember where we've developed some of those skill sets from. Absolutely.
Thank you for saying that. One more question about the medical intervention. So our audience, I'm sure they have this question a lot. Talk to us about PRP and how much it is these days. Because when I used to work in hair transplant surgery 10 years ago, the PRP wasn't that success. It was like 60% successful or like 40% successful, and with no common denominator. Nobody knew why you're going to be benefiting from PRP and this person not. So tell us about 10 years now, where PRP is.
Okay, I'll tell you what my opinion is.
Yes.
I think PRP has a role to play,
Mm-hmm.
but I think that there's a tremendous amount of variability with PRP. Platelet-rich plasma, this is where we take blood from you, we spin that down, we isolate growth factors, and we inject it to the scalp. What do I mean by variability? If I take your blood versus my blood, if I take your blood on a Monday versus a Friday, you're going to have different levels of growth factors, just like how your blood levels change, your B12 levels, your vitamin D, everything changes. So, and then the other thing with PRP, it has a lot to do with what's in your diet, your stress levels. Like there's a lot of variabilities that go into getting great platelet-rich plasma. So we, at my office, we do PRP. We absolutely do. And I think there are some patients that get really nice results. I think it's great if you have an inflammatory condition of the scalp. It does help with some hair growth. I, though, do more mesotherapy in my office, specifically with dutasteride, because dutasteride is a medication that we know decreases DHT by 90% on the scalp, and there's much less variability. It's consistent. We know it's standardized. And so I find that I'm doing less and less PRP and more mesotherapy. And I also think there's something else to think about, which is exosomes, because exosomes from umbilical cords that are tested and they're from like a really good source, there's less variability there too as well, because you know exactly what you're injecting. You know how many
Factors and all
yeah.
that.
So with PRP, I think what happened was, you may not like this answer. I think with PRP, a lot of maybe trichologists, dermatologists, they went out and they bought these, these nice expensive machines that spin blood down. Okay, and they cost a couple $1,000 based upon one machine you're buying. But everyone's protocol is all over the place, literally.
Yeah.
Okay.
Yeah.
How many RPMs it spins and how they're injecting it, and like what's their pre-plan versus their post-plan, how many injections you have to do, how many, like it's all over the place. There's no standardization.
And the technique too, how you're injecting it.
How you're injecting it. Are you using meso needles? Are you injecting it too deep? So I know that I'm not saying that PRP doesn't have a role to play. I think it's a great option if you're someone who doesn't want to use any pharmaceutical medications. But I've over time just felt like it's not as impactful as other options.
I've been telling people with PRP because if you don't have the nutrients in the blood to use for the PRP treatment, it's going to be non-beneficial. However, And usually if you're losing your hair, it's because you're depleted in something, you're malnourished in something. So figuring out doing the blood work to make sure you're a candidate in the first place. So yes, like you may be a candidate, you may not be, but nobody's actually discovering if they actually are a candidate first to have platelet-rich nutrients. And
we don't know. We really don't know. Even if you get a blood test, we don't know if you're going to get great PRP. That's reality. It's kind of like we're in the dark in terms of
especially
there's no
for
test
women.
to say, oh, you have great PRP.
Yeah. And I tell them like I tell them if they're going to get good results, like save it for when we stop the hair loss and get the hair loss growing, and then use the PRP to stimulate the hair growth. Yes, but until you know what's causing the hair loss, there's no point.
Yeah,
I don't know if I'm
a lot
wrong
of
saying
patients that
that.
have anxiety and they're scared and they want to do anything they can to really preserve their hair. It's really
especially
I do
with
love
women with
meso. I
cycles.
use mesotherapy because it's right in there. It's jumping right in, and you know you're already putting in the nutrients in there. Like I'm so happy you said mesotherapy.
Yeah, because you can do mesotherapy without pharmaceutical medications. You can do it with natural things, and you know exactly what you're injecting. It's caffeine and stuff like that.
So going back to your mesotherapy with the dutasteride, is it like a liquid form of the dutasteride?
Yes, it's a liquid form. Well, it's a liquid form. Yes, it is.
Well, that's a very interesting idea, actually. And
what was that?
The dutasteride, like do mesotherapy with the dutasteride.
Oh.
Yeah. And then the other reason is dutasteride is a large molecule. So, this helps you're doing microneedling of the scalp, right? Which is going to improve natural blood circulation to the scalp. And you're injecting a larger molecule under the epidermis. And then it stays localized. Or at least it should stay localized for prolonged periods of time before it kind of breaks down. And then you're using a meso needle that goes exactly to the area where the bulge is. Now, at the end of the day, this is a little alchemy. We all know this, right? We're just hoping that these things are going to work. But the best thing that we can do, whether you're a trichologist, a dermatologist, a hair transplant surgeon, a hair loss expert, is we can try to take the best things and give that to our patients. That's all we can do.
Yeah, 100%, 100%. Do you have any questions, Carrie?
No, I want to keep talking though. I definitely want to stay in touch with you.
If you want,
let's definitely stay in touch. I would love to do more with the hair wire. How large is your Facebook group?
It's 13,000 or 12,000.
So we have our Facebook. So we have the hair wire for the front end. We have the Faculty of Trichology in the back end, which is for members. But I have broken it out so we have the umbrella of trichology with the different levels they are. So starting point, practitioner, or expert. And then your breakout sectors, which I'd love to introduce you to the sectors. But the sectors are based on where your background is. So cosmetology, surgery, SMP. I have 11 sectors. And so then that way we could all work together. But still, there's stuff that's controlled. Like there's no reason you need to be learning about cutting classes in the cosmetology as a trichologist. So that's for cosmetologists. There's no reason I should be knowing about transplants, maybe just like how to advertise it to get you clients, but
you want to know the basics. You want to know the basics. So
that but the deep and gritty, that's in that sector and it's controlled. So you cannot go in there unless you prove that you belong in that sector. So it's very controlled. And then with the umbrella, the faculty you've created is so that way we could start doing these roundtables and bringing people together, because we have so many of these conferences, but nobody's talking about their background and expertise and bringing a formal roundtable and talking about the nurturing, the gardening,
Well, you get more information from these podcasts sometimes, because when you go to these conferences, it's all about showing off, essentially.
Yes. Do you go to ISHRS a lot every year?
Yes.
Yeah.
Okay.
I didn't get to go this year because my grandmother passed away, but I will be in Rio de Janeiro next year.
Sorry.
I apologize about your loss.
Thank you.
But furthermore too, we also have our groups independent. So the hair wire, we also have support groups, which we have built our first one as a model, and we want to create the other ones for the specific types of hair loss. So we have a hair wire support group for telogen effluvium, and so forth. And that one we right now currently have 13,000, I believe it is. So each group, so we're really making sure that we're really categorizing things and serving people correctly and not putting everything in the sink. Because I find when you get that knowledge, you get overwhelmed. And we don't overwhelm
I'm excited to get more involved. So I'm happy I had the opportunity to come on the hair wire.
Thank you.
and let's keep the conversation going, and hopefully we can do more collaborations.
Perfect. I forgot to ask you one more question.
Yeah.
Do you have do you believe SMP will be good for hair transplant surgeries?
Oh, absolutely. I think S&P, scalp micropigmentation, has a role to play. Absolutely. Especially for patients, maybe if they had a poor FUT in the past, they need to do camouflaging, or if they have really like a poor donor supply and they want to cover a certain area of the scalp, I think S&P is an option. It's not for everyone, but it is an option.
So this is how I start with hair loss. I am an SMP technician. This is how I started. In Dubai, I worked for a hair transplant surgeon for celebrities, for Bollywood stars. I did SMP for a couple of Bollywood stars. I'm famous over there a lot. And then in California, this is how it. I forgot to ask you about that.
Yeah, no, I think look, there's a lot of roles to play, and at the end of the day, this is about restoring confidence, right?
Right.
Doesn't matter if you're doing trichoscopy, you're a trichologist, hair surgeon, an SMP expert. It's all about confidence
Perfect.
building
Thank you.
for our patients. So
Now, where can our guests and our followers find you? Can we share that with them?
absolutely, yeah. You can find me anytime you type in hair loss. I'll
Ah,
pop up
nice.
probably.
What is your TikTok channel?
So I have 2 TikToks. One is Root MD, which is I believe it's 16,000 members around the world. We talk about hair loss every day.
Can you spell it for us so we can put
Root,
it up? For them?
ROOT MD.
ENVFY.
Yeah. And then I have Dr. Kopelman as a separate channel, and then Dr. Ross on Instagram. And then I have an Instagram channel where you just type in Dr. Kopelman. So
We
I'm
need to
actually
get your link tree.
yeah, my link tree.
Dr. Kopelman and Dr. Ross.
Dr. Ross is on Instagram.
Okay, so I'm going to put this up there for everybody.
Mhm.
There, can we see that? Oh, no, wrong one. There we go.
No,
Right
not
there?
Root Envy. No, you got it wrong.
See, good thing I said
MD, right?
MD.
Root
There we go.
MD
Root MD.
and
MD.
Dr. Ross is spelled out.
He put it for you in the private chat. Before
there we
we
go.
leave, and while she's working on that, what else do you wanna final words for our telogen effluvium group?
I know that telogen effluvium is a very stressful condition because I treat this every single day. So I get what it's like to lose hair. I've seen many patients walk into my office with a bag of hair, or patients who are counting every single hair follicle. This is stressful. And the reality is that if you are experiencing this, there's hope, because trichologists and doctors like myself have treated telogen effluvium. We treat hundreds of patients, and there are treatment options out there, both natural and pharmaceutical. So though you might be in despair at the moment, this is what we love doing. We love helping restore this level of confidence and helping you to regrow your hair. So that's what I would say.
Excellent. Well, thank you so much, so much. We really, really appreciate your presence with us, Dr. Ross.
Thank you
we
so
really
much.
appreciate
And let's
that.
do this again soon.
Sure.
Yes, please,
100%.
please. I really enjoyed you. A breath of fresh air, I have to say. So thank you for coming on.
Yes.
Thank you. Okay. Goodbye.
Thank you so much. And until next week, see you. Bye.
Nope. I don't know how to